Hello. The nationwide opioid crisis is having a devastating effect on individuals, families, and communities, and is imposing enormous financial costs on federal, state, and local governments. Since 1999, deaths from prescription opioids have more than quadrupled. Recent figures are sobering. According to the Centers for Disease Control and Prevention, in 2015, 22,598 people died from prescription opioid overdoses. And the CDC has suggested that the existing statistics may be understated because they do not fully consider the direct and indirect effects of opioids on individuals with other serious health conditions. The financial costs of the opioid epidemic are borne primarily by states, cities, and local communities. These costs arise from medical care from individuals suffering from opioid-related addiction, overdoses or medical conditions, treatment of infants born with opioid-related disease, counseling and rehabilitation services, social services, including assistance with income, food, and housing, law enforcement and public safety efforts, and finally, lost productivity of their citizens. It is estimated that the cost to all levels of government has been $502 billion, including the financial impact on individuals and families. The human toll is enormous. In response, government intervention at the local, state, and federal level have modified existing laws and implemented new strategies and explored options to reduce the economic and human impact of the disease. Our policy brief recommends that action at the federal level is required to promote and enhance existing policy and strengthen the healthcare system. It is essential that policy and strategy at this level be based on evidence and proven to work at the broadest level while remaining cost-effective without needing to modify existing infrastructure and resources. The first recommendation is to increase adherence to evidence-based prescribing practices. Guidelines from the CDC offer best practices to ensure safe treatment of pain while reducing the risk of addiction and overdose. State databases for monitoring prescriptions identify individuals at risk for addiction and support accountability for providers that treat pain. The medical community can prevent opioid misuse by altering prescribing practices to limit the supply of prescription opioids. The second recommendation is to expand access to medication-assisted therapy. Proven medications like buprenorphine, naltrexone, and methadone have been shown to be safe and effective at treating opioid use disorder, yet have not been deployed to maximum benefit due to historical stigma and prescribing limitations. Evidence supports the use of these medications and has found that programs that treat with medication are more likely to have patients remain in treatment compared to those that only receive counseling or non-medication support. Finally, access to the overdose reversal drug, naloxone, gives providers, pharmacists, and laypeople a powerful tool for saving lives without the need for a prescription. Since 2001, all 50 states have implemented policies that allow access to naloxone. Good Samaritan laws protect bystanders that call emergency services, and promotion of naloxone kits has been supported by evidence that family members, bystanders, and first responders, such as police or firefighters, are saving lives when empowered to apply this medication. Together, these recommendations are well supported by evidence and have been shown to be cost-effective while saving lives and reducing the burden of opioid abuse. This is a sound investment in the future and makes for good policy, good government, and healthy communities. Together, we can make a difference. Thank you.